Welcome to Channel 1. Apollo Multispeciality Hospital launched its new facility, the Apollo Genomics Institute AGI. And for this announcement, a press conference is held on 29th of February at Hyatt Regency.
Our Director of Medical Services, Dr. Surinder Singh Bhatia. Dr. Bhatia is an Army veteran, and would like to also invite Dr. Shashwati Mukhopadhyay, clinical geneticist, and she's been providing support to all. So she has done her DM, but she's a trained obstetrician and gynecologist by training, but has taken to genomics. Clinical genomics as a specialty. And I am Dr. Rohit Bhojaraj. I am a doctor by training, but I handle the children's, which is the pediatrics, as well as genomics across all Apollo hospitals across the country.
Our group DMS from Apollo Indraprastha Hospital, my colleagues on the dais, friends. We have a couple of events planned for today. In the evening, we're going to discuss in detail with doctors about the genomics, but I think I will keep myself limited to informing the best news people here about what it means. So I must tell you that today is a very good day in the sense that on a rare day we are inaugurating this a somewhat new concept of Genomic Institute in Calcutta and in the Eastern India for the first time. You must have heard regularly that basically diseases are either lifestyle diseases like diabetes, hypertension, ischemic heart disease, and so on, or they may be infectious diseases which you deal with in our day-to-day practice, viral diseases, amoebiasis, giardiasis, hepatitis B, and hepatitis C. Genomics plays a very important role in both this group of diseases, both in infectious diseases as well as in lifestyle modifications, because there is some inherent genomics in each individual which allows these infections, lifestyle modification diseases to have a different outcome in different situations. So you'll be hearing a lot of terms, genes, genetics, genomic, proteomics. So these are actually different terms which I try to simplify. When we talk of gene, we talk of a limited information. A gene being transmitted from a mother to the child, whether it's autosomal dominant, autosomal recessive, depending on that, whether it's 50% penetration, 100% penetration. So it's a limited concept of genetic diseases. Genomic is, when we are talking of genomic, we are talking of the whole gene constituent of a body. So this is usually, we evaluate by DNA sequencing. Proteomics, on the other hand, is proteins which are generated out of these genomics. So it's an end product which we are talking about. So while genomic is more or less constant in an individual, proteomics will change. Protein production will change depending on the stress, internal stress, external stress, and the situation. So this is to understand that these three are different terms.
Actually speaking, we have been around for the past 1 year, but this is our first formal launch. So I would just like to inform you a little about what we have been doing, what Apollo Genomics offers, and what is our plans for the future. As we are conquering new heights of modern medicine, we are looking at our genes to see what exactly we have inherited from our forefathers. Have we been given good genes? Have we been given bad genes? So the questions continue in our minds. Do we harbor mistakes in our gene. Can we correct these mistakes? Are we going to transmit them to our next generation? This is extremely important because most of my patients, they are very scared that if they have genetic mistakes in themselves, they don't want to have their next offsprings saddled with these mistakes. In Apollo Genomics are trying to give you answers.
भोजराज आप लोगों के सामने धन्यवाद प्रस्ताव रखने के लिए मैं आई फील वेरी प्रिविलेज दैट आई ब्रिंग ग्रीटिंग्स फ्रॉम आवर चेयरमैन डॉक्टर प्रताप सिंह रेड्डी who is the chairman of Apollo Group, and it is his vision to realize that all people in the we want to touch a billion lives. So हम लोग इतने लोगों को देखभाल करना चाहते हैं, उनकी ज़िंदगी में कुछ अहमियत पाना चाहते हैं. इस चीज़ के लिए हम आप लोगों के आभारी हैं कि आप लोग ने अपना कीमती समय निकाल के आप यहाँ पे आज आए हैं, और आप लोग हमेशा अपोलो हॉस्पिटल के लिए आपने मीडिया को बताया है, लोगों को ये चीज़ बताई है कि अपोलो हॉस्पिटल में जो टेक्नोलॉजी या किसी भी तरह का प्रोसेस चेंज विच कैन ब्रिंग चेंज इन लाइव्स ऑफ पीपल, इट्स एक्सट्रीमली इम्पॉर्टेंट. वी शैल ऑलवेज रिमेन इंडेटेड टू यू for being keeping the good word. As usual, Apollo Hospital, Apollo Group, Apollo Multispeciality Hospital at Kolkata is not restricted to Calcutta, but is responsible for bringing in technology and improving healthcare across the entire eastern region.
জেনোমিক্স যেটা আছে সেটা থেকে তিন রকমের আমাদের হেল্প পাওয়া যেতে পারে. প্রথম হচ্ছে যে স্টাডি করে আমরা ডায়াগনোসিস আর্লি স্টেজে করতে পারি, সেটা হচ্ছে এক নম্বর. সেকেন্ড হচ্ছে আমরা ফ্যামিলিকে ওয়ার্ন করতে পারি যে আপনাদের একজন আত্মীয়রা আছে, আপনারও হতে পারে, তার জন্য আপনি স্ক্রিনিং করুন, টেস্ট করুন, যেন আপনার যদি হয়ও আর্লি স্টেজে আমরা ডায়াগনোসিস করতে পারি. থার্ড হচ্ছে ট্রিটমেন্ট অল্টারেশন হয়. যদি আমরা জানি যে আমরা একটা কোলাইটিস পেশেন্টকে ট্রিট করছি, তার একটা জেনেটিক অ্যাবনর্মালিটি আছে, তাহলে আমরা জানি যে কোনো ওষুধ দেওয়াটা ডেঞ্জারাস হতে পারে. সো ইট হ্যাজ অ্যান এফেক্ট অন ডায়াগনোসিস, it has effect on predicting the risk in the family, and it has effect on management, which can be now personalized management.
This actually Apollo Genomics has started 1 year before. Actually it was started in a full-time basis from April 2023. We are 11 months old, you can say, but the launch has started today. So, but we are getting patients, we are getting referrals, we are able to give management, diagnosis and counseling, and we have been able to help a number of families also. At least in my count, more than say 500 families we have been able to help. But we are looking forward for helping more families once the referrals are coming to us, because you see we are referral based. Clinicians have to understand that they are looking at a genetic disease. Only then will they be saying yes, please go for a genetic diagnosis.